Everyone. Thank you for joining us. This is the third media briefing that we are holding as part of Brown County Public Health's collaboration with our local healthcare system partners, Advocate Aurora Health and Aurora Baycare Medical Center, Bellin Health Systems, Prevea Health, HSHS, St. Vincent, and St. Mary's Hospitals. We're also working collaboratively with Oneida Nation Public Health and the De Pere Health Department. Last week, our briefing featured patients and families who talked about the very real and very personal impacts of COVID-19. Today, we're going to hear from healthcare workers who will share their stories about working with families, couples, children, and those with mental health issues and addictions, as well as those in the workforce. They will share how this pandemic is impacting people in very real ways, and they will share strategies that have helped their patients and clients cope with what is going on. Before we go to our first speaker, I'd like to provide you with a brief overview of the current status of COVID-19 in Brown County. Today, we are reporting out 14,841 confirmed cases. That's an increase of 269 over yesterday. We are sitting at 81 deaths. Out of isolation, we have 10,731 individuals. That's an increase of 281 from yesterday. As always, you can find this information on our dashboard that is updated daily online, www.stayhealthybc.com. You can also check out the Wisconsin Department of Health Services website for current information. One thing I think everyone would agree on with these days is that there's a lot of stress and anxiety surrounding the pandemic. So today you'll hear from healthcare professionals who are helping families, individuals, children, employers, and employees navigate through these challenging times. We're going to start with Lisa Tudsky. Lisa is a licensed marriage and family therapist for Prevea Health, working with both children and adults, specializing in individual, couple, and family therapy. Today, Lisa is going to share her experiences working with couples and families. Thank you, Lisa, for joining us.
Thank you for having me. In today's world, I think families and couples are struggling quite a bit. One of the things that I'm seeing a lot in my own practice is that routine is off. So families, couples, we're used to a certain routine and a certain rhythm to our life. That does not exist now. There's also so much unknown. Much of what we do every day is unknown. Are children going to be in school? Are we going to be working from home? Are we going to be in person? Are we going to be quarantined? Are we going to get that call from the health department telling us that we've been in contact? Are we safe? And so it raises, I think, a lot of issues as far as unknowns for families, for couples. It's also a lot of time spent together. And time spent together can be a very, very good thing. Time spent together, though, is not always a good thing. There are certainly families and situations where there are domestic abuse issues, where there are concerns around safety, and those are things that we need to attend to as mental health professionals, things that I'm talking about here in my office. Often school and work is a safety net for people. Being able to get out and move about in the community is a safety net for people. And I think families and couples are missing all of those activities and things that they did together. We are in a time of tradition. It's the holidays. We have Halloween and Thanksgiving and Christmas, and so much of what we would normally do with our immediate family as well as extended family looks quite different. So there's issues of grief and loss as well.
Thank you for sharing, Lisa, and thank you for sharing your story. When we talk about family stress, it usually leads to a discussion about what our children are going through. This can be a very unsettling time for them. Joining us next is Dr. Donald Bino. Dr. Bino is a local pediatrician of 16 years at Aurora Baycare Medical Center. He's also the Associate Chief Medical Officer of Aurora Baycare, giving him a unique perspective on the COVID-19 effects on children. He consults with parents on the medical and emotional well-being of children, and local agencies and public entities have also been reaching out to him for a medical perspective on safety measures during these challenging times. Dr. Bino, thank you for joining us today.
Thank you, Claire. So the COVID pandemic has brought us all a new normal. It includes masking, social distancing, and other protective measures that try to help us protect from the spread. This addresses our physical health, but COVID brings some new challenges to our psychological health too. Children and adults are both being affected. We all need to take the next step to provide us with a new normal in our routines that will help us make it through. Just as children are different from one another, there are also differences in the ways children respond to the change in their daily lives. We know that children frequently take on those stresses of their parents and have the same feelings they do as well. It is important to speak to our children at their own level about their fears and their concerns, validate their fears, clarify misconceptions, and assure them that they will be cared for and loved, and that we will all get through it together. Young children may see a parent being home as a very good, positive thing. But for older children and teens, being away from their friends certainly makes it hard. As adults, many of us get to get away from the home, either to go to work or even to the store. It can feel like a reprieve for us. Kids and adults who are homebound, unfortunately, don't have that. So we need to find creative ways to give them a semblance of a social life, whether that's reaching out through virtual play dates, using other ways of communication, going outside for exercise, or even going for a drive to see nature. Certainly these things can be beneficial. COVID-19 has significantly upended our children's world order. Many of the rituals and routines that they would normally depend upon and provide them safety have been disrupted. Just like adults without structure, they too feel a bit out of control of their lives. What we want to do is to try to find some simple structure to every child's day, give them some predictability, perhaps some new additions to their normal routines. Share ideas with friends and other parents as well. When the things children have enjoyed, such as sports, play dates, hangouts, and parties, have been canceled or changed, this also causes stress. They become depressed, fearful, bored, or maybe lonely. The children who struggled with those symptoms before COVID are even at a higher risk now. Parents may see more behavioral issues as their kids try to cope. If there was illness in the home, job loss, economic or food access issues, this makes it even harder for their children. It really is important to give kids and ourselves some grace to feel the emotions of the weight of the pandemic. Use resources. These are tough times, but we're not alone. If one parent has run out of creative solutions, another parent, a friend, or a family member may have great ideas. Enlist your children too, as many of them have an idea as to what might make them happier. Perhaps a family movie night, a family game night, things to do together without a screen, as many of them are spending screen time for school. My great-grandmother lived through the 1918 pandemic, and her advice at those ages was, "This too shall pass." I would add, be kind to one another, don't forget to breathe, and if you need it, make sure to reach out for some professional help.
Thank you so much, Dr. Bino.
You bet.
As you've been hearing, the stress, strain, and uncertainties of emotional dealing with the pandemic can take a toll on everyone. And as you may have heard, those dealing with addictions, as well as those suffering from mental health issues, are having an especially difficult time. Shedding some light on this next is our next speaker, Mary Kreischer, the Director of Oneida Behavioral Health Services. In addition to sharing what she's seeing on the AODA front, she can also talk about the impacts of the pandemic on behavioral health teams. Mary, thank you for joining us today.
Thank you, Claire. At Oneida Behavioral Health, some of the things that we are seeing is that some of our people are turning to alcohol and drugs as a means of coping. This pandemic has really created isolation in people and really making it difficult for people to connect to their support systems, especially if they don't have technology. We have moved everything to virtual sessions, and technology is really, really important. And if you are out in the residential or rural areas, you don't always have access to that technology. So some of the things that we have been doing is really encouraging people to use public places, going to parking lots, getting on the phone, connecting in social support networks, attending a counseling session. The other things that we've been really seeing is increased need for residential treatment. And during this time, not all residential facilities are able to take patients when they're in their highest need, either because of the social distancing or having the correct PPE in place, processes in place. Our increased services for recovery coaching has really been a need in the community. We have been giving out a lot of opiate overdose kits, which that, you know, if you can't get in, we want to be able to give some kind of supports and resources to people so they can still be with us tomorrow. Some of the other things that we're, you know, seeing is that the increased need of clients who become suicidal, you know, during this isolation, hopelessness, and alone. Because there's also that shortage of getting people into the psychiatric hospitals, our outpatient therapists are really working on an outpatient basis, trying to provide that intense support for people, creating the safety plans for people to be able to stay safe and still be in their homes with their families. And that is an increased stressor for the therapist as much as it is for the patients who are going through that. And, you know, regarding families, I think Lisa might have already touched on some of that, but that increased need of juggling jobs and trying to be a teacher, taking care of your kids at home has been a real stressor for families, as well as all that financial stressor stuff that takes place if you're not able to work or you've been furloughed or laid off or all of those other things that come in play. Some of the things that we would really strongly encourage people to do if you're in recovery, get back to the basics. Get a hold of your sponsor, get connected with some virtual support networks. All the AANA, all of those resources do have virtual meetings right now. If you can't leave your home, there are resources available to you. If you don't have good technology, get to a place where you can get some technology. Some of the things that we have put in place at Oneida Behavioral Health is that we have created on-site telehealth offices. So if people are not able to connect in their homes, we are allowing them to come in and use some space in our office so they can still get connected to their providers, to their doctor, their psychiatrist, and be able to attend the therapy groups, since we want them to be supported and be able to get help. And just as Dr. Bino had said, you're not alone. There are people out there that are wanting to help and are ready to help. So if there is a need, or if you are even just stressed about anything, nothing's too small to make the call. And of course, there is a National Suicide Prevention Line that I think is available that anybody can access. It doesn't matter who you are, where you live. It's a National Suicide Prevention Line, which the number is 1-800-273-TALK. So if you are in need of services, you can certainly reach out to get some support. Thank you.
Thank you so much, Mary. We appreciate your insights. For those who are continuing to work through the pandemic, there are also concerns and stresses. This is true whether you're in the office, you're working in a restaurant or a store, or if you're working at home. It also poses challenges and stresses for employers. Charles Latour is a board-certified behavioral health counselor with Fallon Health and has been working with employers and employees throughout the pandemic. His focus is helping people become the very best version of themselves, even during these difficult times. Utilizing the latest research in psychology and neuroscience, Charles helps his patients focus on personal resilience, well-being, and the ability to increase emotional self-regulation. Thank you, Charles, for joining us today.
Sure, thank you. Thanks for having me. So, yeah, I get to talk about work, and it's interesting because I would say everything that has been mentioned thus far actually funnels in many respects to the work situation. First thing that we could probably look at is the variability of regarding work. There are certain industries that have been hit differently than others, but every industry that you could think of in some form or fashion has been impacted. At Bellin, our obvious work area is healthcare. what's going on in the healthcare industry, particularly frontline providers and the like, have been unprecedented in the degree of stress and adaptability that has been required for them to work through what they have dealt with. So it was mentioned earlier, uncertainty, the unknown. Probably what I have found in the work that I have done thus far is the greatest impact. If anything is up there with it, it is more than ever employers have had to look at safety. How do we provide safety for our employees? Now more than ever, that is at the forefront. And you don't have it's not just physical safety, it's emotional safety. There's the safety that helping people not get the virus, creating a safe environment, but also the emotional safety within the environment matters as much now than it ever has. I think the other things employers are looking at and experiencing is the tremendous change in staff patterns. Working from home is in many respects the new norm. What does that create? And then for employees working from home, it's when your mom and dad, even if you're still at work, but you're at home, your children still see you as mom and dad. And the demands that they create don't go away just because you're home and you're working there. So that type of thing I've heard time and time again is one of the biggest changes that people have had to adapt to. So, and even on that note, change in its own right is difficult, all things equal. This has catapulted us into a different stratosphere of dealing with change and uncertainty, because this one is the most ongoing that we have had to deal with. And I think that's true regardless of industry, healthcare, hospitality, restaurants, so far and so forth. Two other things that I'd like to say that I've seen most problematic: communication and working from home, and the distinction is created with respect to the amount that we can communicate on a face-to-face level. Communication, working together as teams, has challenged us more than it ever has before. And my feeling is, what I've seen so far, the teams, the organizations, the employers that have the greatest amount of adaptability and change management skills, the emotional response flexibility, are the ones who will get through this the best as we continue to navigate through an unprecedented time.
Thank you so much, Charles.
Sure.
And thank you to all of our guests today for shedding some light on what is happening in our community from a mental and behavioral health perspective. These are the faces of COVID stories that we don't often hear about. We want to remind everyone that the actions of each and every one of us take today, including masking, physical distancing, washing your hands for at least 20 seconds, and avoiding gatherings, will impact what happens in our community tomorrow and in the future. Before we go to Q&A, I just want to let everyone know that we will not have a media briefing next week due to the election. Our next media briefing will take place on Wednesday, November 11th, and we will provide more details closer to that date. With that, we'll take your questions. As always, please state your name, the media outlet you are reporting from, and who the question is directed towards.
Hi, Rob Sussman from WTAQ. This question is for Claire. I've noticed that there were, 269 cases new since yesterday and 281 out of isolation. Are you seeing a decrease in the active number of cases in Brown County over the last couple of weeks?
Hi, Rob. That's a good question. I wouldn't say that. I would say it's more accurate to look over a 7-day period of time or a 14-day period of time, and the averages during that time period. Over 14 days, and I believe over 7 days, we are still trending upwards. So the answer to that would be no.
And then we've recently learned that the President of the United States intends to come out to Austin Straubel Airport sometime on Friday. We have no idea when. What is the kind of health department's official guidance on that for attendees, and whether or not there's any evidence for the President of the United States in holding this rally?
So just like any gathering that would occur in our community, our recommendations would remain the same. Make sure that there's enough space for individuals to physically distance from those outside of their household, so 6 feet or more. Everyone should be wearing a mask, including the president. Make sure that you're, washing your hands frequently. If you don't have access to washing your hands, use some hand sanitizer. And any type of gathering at this point is going to produce some level of risk.
So would you ultimately suggest against it entirely?
The safest option would for everyone to stay at home and for there to be a virtual event. We know that's probably not going to be the case. So if you are going to choose to gather, again, think about how your individual actions might affect the community as a whole. And if you choose to gather, keeping those measures in place would be what we recommend.
Thanks, Claire.
Hi, this is Benita from the Press Gazette, and I have a question for anyone here. So next week there's going to be a couple school districts who decide whether or not to start in-person classes again. So I was just wondering if you guys have any guidance or advice for students and how to take care of yourself in terms of that.
I can certainly speak to that from the sense of families. Children and families some are really wanting to go back to school, some are wanting to stay virtual, and that's a decision that, we are encouraging families to make for themselves. One of the things that's been really difficult for children is the in and out nature of school if they have been in person. A lot of anxiety that we're seeing for kids around, am I going to be able to go to school? Am I going to be able to stay in school? Is school going to close? Am I going to be quarantined? So what we're doing here with our children and families is really giving them some different coping skills to manage that anxiety, helping them to cope with the changes and the challenges, teaching them some skills around being more flexible, and then also working with families, parents specifically, on just this idea that this is going to be a different year when it comes to school, and it is okay for everybody to just do the best that they can, which means some days they're going to do really well and some days they're not. There's a lot of challenges with learning from home. There's also a lot of challenges with that back and forth and in and out. So encouraging kids to be able to talk to their parents about that, encouraging families to have some conversations about that is how we're handling it here.
Okay, thank you. I just have another question. So, following up on what you just said, so do you advise that schools do reopen or against it?
That's a decision that we're letting all school boards make on their own. We know that kids, some kids are doing well in online school. Some children are doing not as well in online school. And it's really a decision that families are going to need to make, that school boards are going to need to make. But there are definite benefits to being in school from a social, emotional, and learning perspective. But we also have to take into consideration that risk of illness. And so it's a difficult question to answer. We're really working to empower children and families to make those decisions for themselves.
Okay. And then just one more question is wondering about with how hospitals are doing with capacity, if anyone can answer that.
Sorry, Claire, we actually couldn't hear the question. Can you repeat that one?
Sure. Benita is
Yeah,
wondering if, go ahead, Benita.
Sorry, yeah, I was just asking how hospitals are doing in terms of capacity.
So Hospitals, all of the hospitals in town are changing how many beds and how much care we can provide. Certainly, we're doing everything we can to ensure adequate care for all of the patients in the Brown County area. We would also hope that individuals can care for themselves and do exactly what Claire was talking about, wear the masks, socially distance, avoid groups, so that we don't see a large uptick in cases as we have been seeing currently.
Thank you.
Rob Sussman from WTAQ here with another question, and this one's for the healthcare providers here. Is there a point in which the cure, in many senses, becomes worse than the disease, with the other things going on, including increase in suicidal ideation, things along those lines? How much should public health departments weigh that into the decisions that they make regarding coronavirus restrictions? And that one, I suppose, is for any of the providers.
So I don't, speaking for myself, and I have not thankfully seen a dramatic uptick in those kind of problems, Rob. Certainly the illness has killed way too many people and continues to on a daily basis. Certainly, too, we are here to support the psychiatric health of our patients and our families. And there are lots of options for help and to reach out if someone is struggling with their own psychiatric health.
And I guess my question maybe wasn't entirely clear. I suppose, how much should health departments, both at the state and local level, take mental health concerns into account when they are working on coronavirus restrictions?
I can't speak for the health department, but from all of the meetings that I've been in with them, they are very actively taking the mental health concerns into their decision-making process.
And I would comment on that and just say that there are a lot of resources out there for families, for individuals who are struggling, and I think our health departments are certainly aware of those and are offering those resources. We're just encouraging people to reach out, whether that be to therapists, physicians, substance use groups, wherever their support systems lie. Those resources are available in the community.
Thank you very much.
Any other questions today for myself or our guests? All right. Thank you so much, everyone, for joining us today. We will see you not next week, but the week after that on November 11th.